So in this video, I'll be showing musculoskeletal assessment. So in this video, my athlete will be having an injured elbow, and I'll be showing what to do for an on-field assessment, and I'll explain what I'd be doing for an off-field assessment. So first, I'd initiate the RP, make sure I have my gloves, scan the area, make sure it's safe for me to enter, and then I could start my primary survey. So what's your name?
Christina.
Okay, and what happened?
I banged my elbow on the floor.
Okay, did you hear a snap, pop, or crack?
A crack.
Crack, okay. And do you feel any numbness, tingling, or burning?
No, not really.
No, okay. And have you had this injury before?
No, never.
No, okay. And how much does it hurt on 10?
I would say about a 5.
5, okay. Now I'd continue with my ABCs. So athlete's airway seems fine, and their breathing seems fine since they're able to talk to me. Just gonna quickly check their circulation. Strong and steady, perfect. So now I'd observe and palpate the area. So I'm just checking for deformity, swelling, heat, contusion. For the sake of the video, we'll say there's a bit of heat and swelling. Apologies. So now, before we proceed, we just check for fractures. First, we verify if it's obvious or non-obvious. If it is obvious, we do PMSC. If it's upper extremity, we'd have the athlete taken off the field, have them splinted off field. If it's lower extremity, we'd have them splinted off field right away. But for this video, we'll say that it's non-obvious, so we'll just do a couple quick tests. Tap test and a crepitus test. So tap test, we'd be tapping from distal to proximal of the injury. So I'm just going to ask you to move my arm. Do you feel anything?
No.
Feel anything?
No.
Feel anything?
No.
Now we just do crepitus test. We're checking for a grating sensation, which we don't feel, so we have negative signs for a fracture. So at this point we could rule out the fracture. So now we'd check for ranges of motion. On field, we only check active and passive, and on the affected side, unlike off field where we do both sides. So I'm just gonna ask my athlete to lift their arm like so.
It hurts, it hurts.
It hurts, okay. So we just did active, so now we're gonna do passive. Does it hurt?
Yes, it hurts.
It hurts, okay. Now I'm gonna ask them to extend their elbow. Does it hurt?
No, that's okay.
No, okay. Now bring your arm back again. Now I'm gonna do it for you. Any pain?
No.
Okay, perfect. So since it's on field, we're only doing flexion and extension. Off field, we do more ranges of motion. Now we're just gonna do a couple of quick a special tests. So we're gonna do the valgus and varus test at 0 and 30 degrees, just to check for joint stability. So I'm just gonna ask you to give me your elbow. So now we're doing it at 0 degrees. Now I'm just going to ask my athlete to bend the elbow a bit. So now we're doing it at 20 degrees. Okay. Perfect. And so that would be it for on-field assessment. So now after for off-field assessment, I'd have my athlete in a clinic or pull on the sideline, just ask them some questions on the background of the injury. So basically sample and OPQRST. So the S in sample would be checking up on the signs and symptoms. A for see if they have any allergic reactions, and if they take medication. P for previous injury, so if they've had this injury before. L, last oral intake, so what they recently ate or drank. E, events prior. O for, then in OPQRST, the O would be for onset. Then P, we ask for provoked, so what provokes the pain. Q, the quality of the pain, so what kind of pain do they feel. S, the severity of the pain. T, and T for the time the pain happened. And then after that, we do a brief palpation and observation of the area again. Again, we're checking for deformity, discoloration, heat or swelling. And then at that point, we could do all the ranges of motion. And like I said, for off field, we do them on both sides. So in this, like in the video that I had my athlete that had an injured elbow, we'd do the ranges of motion on both elbows. So the ranges of motion we'd go through for the elbow would be flexion, extension, supination, pronation, and wrist flexion and extension. After that, we do the special tests again of valgus and varus at 0 and 30 degrees. And then we do manual muscle tests of the muscles we suspect that might be affected. And that's also why we're doing the ranges of motion, to see if it's if the injuries are related more to a strain or a sprain or a contusion. Then at that point, based on all these criteria, we could determine if the athlete could return to play, and if we could just, by taping them, if they could return to play. More specifically, the criteria would be if for the manual muscle test, that the muscles we tested that we suspected would be affected have a grade of 4 out of 5 or higher, or previously in OPQRST, when we asked about S, the severity of the pain, if it was if by the time you ask that the athlete tells you it's a 3 on 10 or lower, because at the beginning of the video the athlete said it was a 5 on field, but if by the time they get off field it's a 3, then that's another indicator that they could return to play, and as well if the range of motion isn't significantly affected. So if that's all okay, that they fulfill all these criteria, we could have them taped and return to play. And of course, after you have them taped, you just gotta verify a few things, such as the athlete feedback, if the tape job is okay, the functionality. Of course, do the manual muscle test and the special tests again to see if the tape job helped. Do sport-specific movements and educate the athlete on whether, basically, well, to take off the tape after their game or practice, and if they do forget, not to sleep or shower with it. In the scenario that they wouldn't be able to return to play, that they wouldn't be able to fulfill the criteria as I mentioned before about the manual muscle test, the pain severity, and the ranges of motion being affected. If they're really in a condition they can't return to play, you'd give them several treatments such as compressive wrap, ice, crutches, or splint, or have them splinted. And that's it.